local health district, Dr. Emma McCahon, as well as our State Emergency Services Commissioner Carleen York and the Parliamentary Secretary for Western Sydney, Shane Mallard. We're here today at the Granville Vaccination Hub, and this is one of many hubs right across our state that are rolling out our vaccination program, but particularly right now our booster shot program. And it's very pleasing that I can say today that 47% of eligible people have now received their booster shot. And it is that effort that continues to ensure that people across New South Wales remain safe during this pandemic. We have one of the highest vaccination rates, not just in the country, but anywhere in the world. And that's a testament to everybody across our state who have made a phenomenal effort to go out, get vaccinated, and ensure that yourself, your friends and your family are safe. So I particularly want to thank everybody for that ongoing effort that they are making, particularly over the summer period. As we now head into mid-January, it's incredibly important that we keep that effort going. So if it's been 4 months since your second dose of vaccination, please make an appointment. Please continue to make that effort. We know that today with 191 people in ICU and hospitals across the state, 50% of people in our ICUs are unvaccinated. So at a time when we have a population right across New South Wales, a 95% vaccination rate, here in our state, we have 50% of people in ICU who are unvaccinated. So the evidence, the facts are very, very clear. Vaccination helps protect you and your family and your friends and the wider community. So please continue to make that effort. If you haven't received your first dose vaccination, please go out and do so and continue this great effort with booster shots. Many of our centres, 40 centres across the state of New South Wales, have walk-ins available. Appointments can be made and the turnaround time is very quick. We've met people today who have come through this centre here in Granville in Western Sydney, and it is an incredibly efficient operation. These centres want to get you in as quickly as possible, and I want to thank our health teams right across the state who are on the front line in a very difficult and challenging time, particularly as we enter the next few weeks. There will be difficulties, there will be challenges, but our health system is resilient. Our frontline health staff are the best in the country and are doing an amazing job under pressure, particularly here. It's not just in our hospitals, it's at all of those hubs right across the state of New South Wales. Those providing vaccinations right across the board, our nurse staff are heroic here in New South Wales. They're inspirational to us all, and on behalf of everybody across our state, can I thank you for your ongoing effort and sacrifices that you have made, not just over the last 2 years, but as we push through this next difficult period of time. Can I once again thank everybody for their patience right across our state, whether that's some of the disruptions that we've seen with food supply and the networks there, some of the queues that we've seen at PCR testing, which we've now seen largely resolve and subside, but the efforts that people have made, the patience that we're having across our state will ensure we get through this period as we have over the last 2 years. And can I continue to ask everybody to treat people with kindness and respect. They are the values that have kept New South Wales strong during this pandemic, and kindness and respect will help us get through this next period as well. The SES Commissioner will also provide some comments after the Chief Health Officer and the Local Health District Executive Director and Minister Hazzard, just in relation to the tsunami warning across the east coast of Australia. Obviously our thoughts and concerns are with our Pacific Island friends, particularly in Tonga. But there is obviously some concerns here in New South Wales. Beaches across our state today remain closed. The Commissioner will make some further comments, but can I just ask everybody, please follow the instructions of the SES, of surf lifesaving. Beaches are closed, please do not swim. These rules are in place to protect you and to keep you safe. Please follow those instructions as the Bureau of Meteorology provides further information to the government over the course of the day, but the SES Commissioner will provide further information in relation to that. I'll now pass to Dr. Chan.
So across New South Wales we have 95.2% of people aged 16 and over have received their first dose of COVID vaccine and 93.8% have received 2 doses. For the 12 to 15-year-old age group, we're seeing that go up. It was stubbornly stuck around 81.5% and it's now 82.1% have received their first dose and 78.4% have received the 2 doses. And pleasingly, the 5 to 11-year-olds, 11.5% have received their first dose of COVID vaccine. It's only been a week that program has started. Sadly, New South Wales Health is reporting the deaths of 20 people with COVID today, 12 men and 8 women. 2 were aged in their 50s, 6 people were aged in their 70s, 7 people were aged in their 80s. 4 people were in their 90s and 1 person was 100 plus. Can I pass on my sincere condolences to the families for their loss. Of the 20 people, 14 people were vaccinated against COVID and 6 people were not. The 2 people in their 50s had serious underlying health conditions and 1 person was vaccinated and 1 was not vaccinated. There are currently 2,650 COVID cases admitted to hospital, including 191 people in intensive care, 61 of whom require ventilation. There were 34,660 positive test cases notified to 8 p.m. last night, including 13,682 positive rapid antigen tests and 20,978 positive PCR tests. Of the positive there were of the 13,682 positive rat tests, there were 11,204 of these positive tests were from the previous 7 days. So thank you for uploading that information, it's very appreciated. And of the 20,978 positive PCR results, they were returned from 122,747 PCR tests. So thank you to the community for that. I'd just like to reinforce the benefits of vaccination. COVID vaccines are highly effective against COVID hospitalisation and deaths. If you are over 65 years, if you're immunocompromised, if you've got chronic heart, lung and liver and nervous system and brain conditions, you're at increased risk of severe disease. So it's even more critical for that age group that they get their booster. And some of that age group and those with those underlying conditions will also be due for a primary course, a 3rd dose in the primary course, and that occurs 2 weeks after your first 2 months after your first 2 doses. So please, it is critical we get those boosters into the most at risk in our community, but also please check with your GP whether you also need that 3rd dose, which can occur, as I said, 2 months later. Also, just a message that whilst generally COVID is very mild for younger age groups, it is important that all age groups can get severe COVID or get deterioration of conditions. So just a reminder, whilst many people that are young have a very mild course, please, if your condition is deteriorating, if you're getting breathlessness or dizziness, please reach out and get assessed. Call 000 if you're breathless and dizzy. It is important, and the health system is here to provide that care. Thank you.
Good morning. I'd firstly like to thank all the children across New South Wales, and particularly here in Western Sydney, who've come out and got vaccinated. We've seen just over 1,600 5 to 11-year-olds through the Granville Centre right here. I want to say thank you to all of them. Thank you for getting vaccinated, for being brave, because what you've done is protected your family, your friends, your loved ones, and all the vulnerable members of our community. So I'd like to strongly encourage all the families out there who are waiting to get their children vaccinated to come out. If you jump online today, there's appointments available next week and the week after to get your children vaccinated. It's a safe and smooth process. Our staff are very experienced in looking after children, and we'd love to see you come down and get vaccinated and look after your families.
I'd like to start by thanking the the Mayor of Cumberland and the team at Cumberland Council for ensuring that we have this amazing facility here at the centre, Granville Centre, to be able to provide the vaccines that are much needed for our youngsters, our 5 to 11-year-olds. Also want to thank the health staff here. They've been here working now. Many of them were actually at Kudos Stadium previously, and they're continuing to do the work here to make sure that as much as possible of the population of Western Sydney and indeed in the broader population of Sydney can come and get vaccinated. Thank you to all the health staff right across New South Wales for the work you continue to do. The single most important thing at the moment is the safety of our community across the state. And the safety of our state is dependent upon the hard frontline workers, or the work that the frontline workers are doing, frontline health workers are doing. And it doesn't matter what part of the state, they have concerns to make sure the local community are well cared for. Having said that, this morning I spoke to Dr. Chris Ingle from Lismore Hospital Medical Council, and Dr. Chris Ingle confirmed to me that they have major concerns in the northern part of New South Wales because of the relatively low rate of vaccination. And that emphasises the message that Dr. Chant was just talking about, the need to get vaccinated. We know that people who are vaccinated do far better when it comes to defeating this Omicron and indeed the other variants of the virus. People who think that it's okay to ignore getting vaccinated, or indeed they think it's okay to go putting other people off getting vaccinated, are doing absolutely inappropriate messaging to those people. They may well be responsible for those people ending up in hospital and possibly far worse. In Lismore, of course, we know that on one day this week we had 6 people in the intensive care unit and all 6 were unvaccinated. You can't get a clearer message than that. When in a hospital you have everybody who is in the ICU unvaccinated, that's a message for the rest of the state. Go and get vaccinated. To the parents who have stepped forward in the last few days to make sure their youngsters get vaccinated, thank you. There's nothing more important. What we're seeing overseas is children are actually less likely to get very ill, but it's still possible. And so as parents, we all have that obligation. Make sure our kids get vaccinated. And the New South Wales Government is doing all it can to provide facilities all across the state to make sure there are vaccination facilities there for your children. But of course, most of us know that our kids have a relationship with their local GP more often than not. From the day they're born, they start getting vaccinated to keep themselves safe. Parents make sure that that relationship with the local GP is an important part of kids' lives. And I would just say we obviously hope that the GPs who are working flat out will be given that opportunity from parents all across the state to vaccinate your children against this virus. And of course, pharmacists also, many of us know our local pharmacists very well. Your children may know the local pharmacists very well, particularly in regional areas. Feel confident to go to pharmacists, GPs. But at the end of the day, you can also come to more than 40 different hubs that the New South Wales Government is providing with frontline health staff all across the state. Finally, just say this, many people I think are forgetting the importance of that 3rd booster shot. It doesn't matter who you are, you must go and get the booster. The booster is showing itself to be one of the vital tools in pushing back against the evil of this virus, the evil that it can wreak upon us. It is clear that Omicron is very transmissible. It's also quite capable of doing damage to various groups of people. And the 3rd dose, the booster dose, does make a huge difference to both ensuring that you can fight back against the virus, but also reduces the likelihood you'll end up in hospital, definitely reduces the likelihood of ending up in ICU, and positively reduces the chances of death. So go and get boosted. Finally, I'll say this to the disbelievers that we still have in New South Wales, wake up to yourselves. The world is telling us this virus will keep killing us and keep putting us in hospital unless we get vaccinated. So to them, forget your silly messages and let people just have their vaccines.
Thank you. So yesterday the volcanic eruption occurred, resulting in a tsunami wave in Tonga and surrounding areas. So we're now on alert in relation to the risk of a tsunami coming to the state of New South Wales, to our eastern shores. So as a result, the Bureau of Meteorology have issued a tsunami warning, and the SES have acted on that. We're working very closely with Surf Lifesaving and local government areas in relation to the safety of our community along the coastal areas. So Lord Howe Island is our most eastern point of New South Wales, and there have been recorded increases in the water levels of 1.1 metre, and we're watching now and getting advice from the Bureau in relation to what is expected on the coast, the east coast of New South Wales. As a result, the beaches have been closed today, and I know a lot of people will be disappointed that it's going to be a very humid day and the Australian way is to get down to the beach. But to protect this community, the beaches are closed, and Surf Lifesaving have removed the flags, and we're making sure that people don't go down into the water. So already today we've had a rescue for Surf Lifesaving of a rock fisherman who had to be rescued. Again, please don't go down to the beaches, please don't go rock fishing where you are placing yourself at danger and therefore placing the volunteers and emergency service rescuers in danger as well. So what is happening today is the Bureau of Meteorology in about half an hour will do another update, but we're expected that the beaches will be closed for the next 6 hours because it's important that we watch the height of the oceans and make sure that people aren't in the water and aren't at risk of injury or death as a result of any tsunami that may hit our shores. So it's important, as I say, not to go down to the beach, but it's also important to understand not to go down and look at the tsunami. So in past tsunami warnings, we've had people get in their vehicles and go down to the beach. That is exactly the wrong thing to do. We want to make sure that whoever is in the nearby vicinity, we can evacuate people safely, we can have the roads as clear as possible, and we can make sure people are safe. Because once that wave, if it does come, is coming, it's very vital and very urgent to get people away from the areas. So I'd encourage all members of the community not to go out boating, not to go to the beaches, not to go to rock fishing places and put themselves in danger. If they are already out on boats, stay away from the shore if they can't come back into safety. Please ensure that you keep up to date with the warnings that are put out both by the Bureau of Meteorology, and that's who we're taking our advice from, the experts, the SES websites and information, and the radio and communication media channels as well that put out important information. It's important also to remember that not all beaches are patrolled by Surf Lifesaving, so again, just use common sense and don't go down to the beach areas. Surf Lifesavers are working with SES volunteers and councils to make sure people aren't putting themselves in danger. Please follow their directions because it is for your safety. It's to make sure that you are safe and do the right thing. So just be aware of the surroundings for wherever you are and stay away from those beaches today.
Commissioner, how likely is it that a tsunami will hit the coast of New South Wales?
Well, based on the advice, there's obviously elements of what a tsunami is, and so that's what we rely on the Bureau of Meteorology to do their modelling in relation to this. So, we're very concerned because once it hits Lord Howe Island, and particularly at the height of 1.1, we're anticipating that will come onto the shores of New South Wales. So we have the Bureau embedded in the New South Wales SES headquarters to give us advice, both in relation to their forecast. So we take all the measures that we can based on their advice.
Are you mobilising to Lord Howe Island?
We have a unit on Lord Howe Island already. We have evacuated 50 people to higher ground from low-lying areas in Lord Howe Island, and that was done during the night. And they're not allowed to go back into those areas until it's declared safe by the Bureau again. And it does take some time. They have to keep watching those water levels.
Premier. So testing numbers, case numbers on PCR tests are down, have been down the past couple of days. PCR tests are still pretty high, by 120,000. Putting aside the rat tests for a moment, is this an indication that the amount of COVID in the community is decreasing, or is it just that we're not seeing everyone with COVID presenting for testing, either on rats or PCR?
Well, I think it's hard to tell, but clearly when it comes to the rapid antigen tests, there was always going to be a significant spike on the first day that you could register, because we're asking people to register all the way back to 1 January. So it's only to be expected that you would have a decrease in positive rapid antigen tests as we move through this few days. And that's why I think we've always said, I mean, case numbers aren't a measure of success in and of themselves, and we've been saying that the entire time. I know the media loves reporting on case numbers, but it's a broader issue, and as we've been saying through this entire time, the focus for this government is just not on the case numbers, it's on ICU and hospitalisations. They're the key metric that we monitor each and every day, and that's the measure in which we tailor our response as we move through the pandemic. Now, in addition to that, I think the key message that everybody has been making today is clearly looking through those ICU numbers at the rate of vaccination. And as the Chief Health Officer, Paul Kelly, said yesterday, this is a pandemic of the unvaccinated. And in circumstances where, and this is not just an Australian phenomenon, this is seen globally, where we're in a much better position here in Australia, particularly in New South Wales, is our strong vaccination rate and strong health system to support it. But when you've got 95% of the population of New South Wales having been vaccinated, yet 50% of people who are in ICU, and you heard the anecdote from the health minister there in relation to Lismore, where of the 6 people in ICU, every single one of them was unvaccinated. It is very clear that vaccination is key. Now, I'll echo the health minister's comments, but I'm positive about the fact that we've had 47% of eligible people going and getting their booster, because it's very clear as well on the evidence in front of us that boosters provide that extra level of protection. So the fact that over a summer break, when many people have gone away on holidays, that we've been in a position where 47% of the population who are eligible have received that 3rd dose vaccination. From my perspective, that's incredibly pleasing. But let's get everybody boosted, and so please, clear message today is if you haven't made that appointment for your booster shot, please go and do so, and you can do that either at your GP, your pharmacist, or one of our 40 vaccination hubs right across the state.
You keep saying that the number that you're monitoring is the ICU. What about the death? We've had 20 more deaths in New South Wales today, about 150 in the last week. 75% of the people that died today were vaccinated. Yeah. Are you not monitoring that number as well?
No, well, of course we are. I mean, ICU, hospitalisation, and death rates. But as the
with the current
well, they're always confronting, because behind every one of those numbers is a person. But in addition to that, what you're seeing, and Dr. Chan can provide further information, is that sure many people have been vaccinated who have died, but also the contributing factors of underlying health conditions are also there. What is very clear is that if you do not have any underlying health conditions and you are vaccinated, the risk of having any severe symptoms and impacts from COVID are incredibly low. So we have to live in the world as it is, not as we want it to be. Vaccination is crucial to keeping us safe. If you have underlying conditions, it's even more important to ensure you have that protection in circumstances where you may contract COVID.
Yeah, just back to James' question. Last week, Dr. Chan said that you're expecting a peak of the plateau in this couple of weeks. Is that still the case? Is it this week?
Well, we monitor that every day. I mean, I think what is encouraging and reassuring at the moment is that we're not seeing an exponential increase in numbers. But we've also got to move through a period where we continue to reallocate the data to the dates that those tests occurred. So when you have those rapid antigen test numbers coming for today, they need to be reallocated back to the date that was actually set out. So look, I would say that it's encouraging and pleasing to see we're not seeing an exponential increase, but there's obviously post those numbers, you then have impacts of hospitalisations and ICUs that flow from that. So we continue to monitor the situation. I think what we're seeing today is incredibly encouraging and pleasing, but there's a long way to go. It's going to be a difficult 3 weeks. Our health system, like health systems right around the country, are under pressure. Our health teams are doing an amazing job day in, day out in providing that care and support for people in our hospitals. But I would say that there's still time to go. we've always said the next few weeks will be challenging and difficult for our state, just like right across the country. But I would say the early indications are encouraging, and what is also encouraging is the tracking of the modelling that we released last Friday, and we'll do so again this Friday on where we sit with the hospital system in terms of the plans that we set out last Friday in terms of how we're tracking against each of those three scenarios. But what was obviously encouraging yesterday was the fact that we're tracking better than best case scenario. I reiterate the point, that does not mean our health system is not under pressure. Our health teams are doing an amazing job in difficult circumstances, but we will get through this. We always said that. We've got through the last 2 years. We'll get through Omicron as well. We have a highly vaccinated population. We have a less severe disease, but one that is more contagious. It's pleasing to see those numbers aren't increasing at an exponential rate, but let's not rest on our laurels. Please go out, get boosted as we move through this next period of time.
When you're releasing your back to school plan,
Yep.
and
Was that a when?
Yeah, and
Yep.
the first day of school, will it look like will it be back to normal, or will it look different to normal school operations?
Well, we are, like other states and territories, have committed to providing our return to school plan at National Cabinet on Thursday, and we will release it following that. As I've said in the past, we're working very closely with the Victorian government to get as much alignment as possible. We think that makes complete sense in circumstances where we are at a very similar stage with the virus. But ultimately, we are committed, as we've said from the outset, to get kids back in school day one at term one. For many of our young kids, they've lost a quarter of their schooling. The significant impact on educational outcomes, on mental health, is severe if we do not get kids back into the classroom. And we need to start 2022 in terms of the school year and make it as normal as possible. So there will be challenges, there'll be bumps along the way. That's clearly going to be the case in circumstances where there's a pandemic. We saw last year when we brought schools back, in certain circumstances schools had to close. Overwhelmingly though, they remained open. Now, as we move through this period, my view is closing schools is the last resort, not the first resort, and we will have provisions in place to ensure teachers and kids are safe in the classroom. Note today the Department of Education, through the Education Minister, is doing a call out for retired teachers and for final year students, and that will provide a buffer. Obviously, as we move through, and there's no doubt that students, teachers from time to time will contract COVID and will need to follow the isolation rules that we have in place. Just like every system across the country, our education system will be under pressure, but we believe the plans that we're putting together will help mitigate against that and will ensure that we have school operating as closely to normal as possible. We're finalising that as part of the plan. So we're in a position where New South Wales Health is working with education, and we're having daily meetings in relation to this to make sure that we have the best policy in place that keeps kids safe and teachers safe. Now, at the same time, we're consulting with the Teachers Federation, who have some strong views in relation to ensuring teachers are safe and completely appropriate. But we believe when we release those plans later in the week, along with other state and territories across the country, that will instill confidence in parents, particularly as well in teachers, that schools will be able to open safely on day one. And the work that we've done, I'm very confident that that's what we'll achieve.
The 50 million rats,
Yep.
are the first 50 million rats that you've bought. Are they going to go into the supply chain, or is the government keeping them to use on government, like where you're going to use them? Can we buy any of those 50 million rats at all?
No, so the orders that we've procured to date, and a number will continue to arrive over the course of this week, commencing from tomorrow. They will be used to ensure the ongoing functioning of government services across the state. So my expectation is that you will see those in schools, in healthcare, in transport for our workers to ensure functioning, as well as supporting the Commonwealth Government. So the Commonwealth Government, as we know, is also in the process of procuring a number of rapid antigen tests, and in areas where we can provide additional support, such as in remote Aboriginal communities, in aged care, if there are areas that the state government can step up and provide that additional support through supply, we will.
So what are you doing to help people get RATs for themselves if they've got COVID?
Yeah, well, we would expect, alongside the public procurement of rapid antigen tests, that the private supply chain will pick up as well. So we would expect over the course of the next few weeks that the provision of those rapid antigen tests will increase. I also want to make the point that the New South Wales government, in collaboration with the Commonwealth government, is still providing free PCR tests. And the numbers that came through today, now while some of those tests would be backdated, there was 120,000 tests that came through. So those PCR testing clinics remain open. What I would say to people today is, if you do have a rapid antigen test, please use that, and that will alleviate pressure on those PCR testing queues, which we're seeing across the board. And the other point to make is, if it is the case that you've received a positive rapid antigen test and registered that, you do not need to go and get a PCR test. What we don't want to have is a duplication of positive rapid antigen tests and a PCR test. We've made that very clear, but that's important because for those people who cannot access a rapid antigen test, they can still access a PCR test in circumstances where pressure has substantially been alleviated on those queues across the state.
Do you have a clue how long the wait time is for the PCR result at the moment?
In fact, I just spoke to Dr. Chant about that. It's improved markedly, and it's now around 2 to 3 days at worst. So that has obviously been improved by the fact. There is still the challenge, because if you go back to Delta, there wasn't much COVID in the community. So in respect of pooling that occurred, you'd have significant batches of tests that would come back negative. Now, in circumstances where a test comes back positive, each of those tests needs to then be individually tested again. So that's one impact on a slower turnaround. But now that the queues have substantially been alleviated, then we're able to get those tests processed more expeditiously. So it's a combination of both. Both those systems are there to support. Appreciate the patience from people across our state. We would expect the private supply chain of rapid antigen tests to improve over the next few weeks, but those PCR tests remain available and will continue to be available for people who need them, who cannot access a rapid antigen test at this time.
Is there any...
So what was that one? Yeah. Yeah.
Why is that? Is there some kind of problem there with teachers to
No, the reason we didn't put them on the exemption list was, firstly, it's not necessary right now because schools aren't back. Secondly, that will be part of our back-to-school plan. So when we release that, now there'll be elements that the Education Minister may want to touch on as we move through to Thursday. Yeah. But that will form part of the plan. I mean, as part of the National Cabinet, we've agreed for teachers to be exempt. But what we need to do is provide greater certainty and clarity to teachers in relation to how that will operate alongside our back-to-school plan. So what we will do later in the week is be very clear to both teachers and parents to instill that confidence around all elements of the plan as we move back to getting school back on day one, term one this year.
Okay, can we just ask you about the number of deaths? Because there's been a significant number this week. How concerned are you about that number being so high, given we keep hearing that Omicron is more mild illness and so many of these people are clear?
I think it's important to remember that the COVID, just as a starting point, the community, there is irrefutable evidence. Every way I cut the data, every way I look at it, every international piece of evidence that the COVID vaccines are highly effective. But we know that some of the key determinants of a poorer outcome from COVID relate to your age and relate to your underlying medical conditions. The vaccines are highly effective, particularly the booster that's required with Omicron to bump that up. But people with underlying health conditions only need to have a very mild illness to sometimes have them decompensate. You know, they're very vulnerable because they're just on that edge. People with severe underlying lung disease, underlying heart disease, their diabetes. And so, for instance, this is not to make an equivalence, but a number of other viruses will also, respiratory viruses, will also impact proportionately on this same group. If we were talking about a flu season, and I'm very loath to compare flu with COVID because we've spent 2 years telling people it's not just a flu, but just as an example, during a bad flu season, we would see many of the same age groups impacted significantly by a bad flu season. So unfortunately, as we go through 2022, we will see and report people who have died, particularly people that are older and particularly people with underlying health conditions. And what can we do about that? Well, we know boosters work. We know that for some of them they'll need a third primary course and then a booster. We also know that as they go about their activities, they may be the ones that choose to wear a mask. They may be the ones that ask people to, keep going to those outdoor settings to have dinner with them and barbecues outdoors. So they were the ones that will be cautious. Now, even if we're in a bad flu season, I would be giving those individuals that same sort of advice about those actions. We also have therapies. So the Commonwealth Government has procured a number of oral antivirals, and I understand that they're going through the regulatory processes. But again, they will be really important in providing another tool to assist for some of these individuals that are more at risk of severe disease. And we currently also have early therapies. So people with underlying health conditions, particularly in these groups, will be assessed for some of the therapies we currently have access to and our local health districts are administering. But it will be around early treatment, vaccination and probably repeat vaccination, and those strategies to reduce their exposure to COVID.
Last one, guys. Do you have any data at the moment as to how many people that have had a booster and are in ICU or have died of COVID?
Look, we do collect the data on that, and I think, as I said, we will put it in our epidemiological report. It's important again for the context. We know that some people that are very elderly, even with the booster, will have a poor outcome. So but I think it's really important that the community knows that the evidence is so clear that boosters, or that third primary dose and another booster, there's good evidence that affords you the best protection. But we will see people that are fully boosted die because of their underlying vulnerabilities.
Thanks, everybody.
Can we just ask, can I just ask you one more about the last one? Flood? Sorry, just in terms of holiday makers, are you particularly worried about holiday makers along the coast that may not be linked in with warning services and things like that locally, or is there any warning for holidays?
Well, we are concerned for anyone who's along the eastern seaboard of New South Wales. So again, we ask people to keep a watch on the SES website, listen to the media and the messages that we put out. The Bureau of Meteorology has information, so there's a lot of information out there, as well as Surf Lifesaving at those patrol beaches are telling people if it's safe or not. The flags are down, so that's a good indication for people who are from particularly Australia as to the rules about going into the water in safe locations. So we're putting as much information out as possible just to make sure everyone is able to make those sensible decisions to stay away from the coast today.
Just while we're on it, sorry, quickly, just like the summer storm season, it's already proven to be quite interesting. What's your general advice to people in the community? Is it worse than what you thought it would be?
Well, it's certainly forecast to be a bad season because we're in the La Nina, so we're in the storm season until at least the end of February, March. I was out at Wilcannia and Menindee and Burke yesterday, and the rivers are still flooding there and flowing down, so those communities, we're working with them to prepare them for the floodwaters. And of course we've had a lot of storms across the whole of New South Wales. Massive storms yesterday which required SES and our partner agencies to go out and assist. So again, a reminder to the public, this is storm season. It has been forecast to be quite a significant storm season, and people should prepare their houses, particularly don't drive through floodwaters, and know if you are travelling and on holidays during this end of the school holidays that you're aware of the surroundings of where you're going, and definitely don't drive into those floodwaters, turn around and find another route.
Thank you, guys.